Sanofi, a global and diversified healthcare leader, reports results for 2017. I have the pleasure of being with Sanofi CEO Olivier Brandicourt. Good morning.
Hello, good morning.
What are your key takeaways of these 2017 results?
Q4 was challenging, but overall in 2017, Sanofi delivered broadly stable business EPS in line with our guidance. In terms of sales, as expected, we saw a decrease in our diabetes business in the US by more than 20%. But this was offset by double-digit sales growth at Sanofi Genzyme at 16.8%, an 8.3% sales increase at Sanofi Pasteur, and in emerging markets, sales were up 6%, supported by continued strong performance in China. Overall, we are pleased with the steps we have taken to strengthen the company. We met our full year 2017 business EPS guidance of 5.54 euros, and we are proposing a dividend of 3.03 euros, the 24th consecutive annual increase.
Where do you stand with regards to your strategy? What progress have you made in 2017?
Our 2020 strategy has four imperatives: reshaping our portfolio, sustaining innovation in R&D, delivering outstanding launches, and simplifying our organization to become more efficient. To reshape our portfolio, in 2017, we swapped our animal health business for an industry-leading position in consumer healthcare. We took control of our European vaccines business and added Flublok. We also added a monoclonal antibody for respiratory syncytial virus, or RSV, and we advanced the carve-out of our European generics business in line with our goal of divesting it by the end of 2018. Our success with these projects has shown our ability to successfully manage complex business challenges and make immediate positive impact for the company. For launches, while some are progressing more slowly than we anticipated, we are delighted with the rollout of our new immunology franchise, especially Dupixent, which exceeded our expectation and drove Sanofi Genzyme's strong sales growth. Today, more than 33,000 patients in the US have now been prescribed this groundbreaking medicine. We also saw good progress from Kevzara, our other immunology asset, and had a rebound in rare disease, which ended this year with strong fourth quarter growth of 8%.
And what about R&D, the second pillar you mentioned of your 2020 strategy?
In R&D, we are developing technology platforms that target multiple mechanisms for complex diseases, called multi-targeting. And this will help us create a competitive immunology franchise, rebuild oncology, and defend our leadership position in diabetes and cardiovascular. Our R&D organization is now achieving above industry success rates across each of the key clinical and regulatory phases and is well positioned to become one of the key players in the industry. And in terms of simplifying the organization, we have fully implemented our new structure with 5 global business units and centralized global support functions, allowing us to deliver the 1.5 billion euro of savings we promised over the past 2 years. So to answer your question, we are pleased with our progress and looking forward to accelerating our transformation in 2018.
Well, speaking of acceleration, the news flow has been pretty strong in the early weeks of 2018. How is Sanofi entering 2018?
Sanofi is starting 2018 at full speed. In just the last months, we have announced major steps towards achieving our strategic goals. We renegotiated our contract with Alnylam, giving us global rights to fitusiran for hemophilia A and B. We announced the acquisition of Bioverativ, which will bring to Sanofi a strong, ready-made franchise in the $10 billion hemophilia market. But we are also looking at this acquisition more broadly as a platform for our expansion in rare blood disorders. We also announced the acquisition of Ablynx, and this enhances our portfolio in the near term with caplacizumab, which we expect to be approved this year as the first treatment for acquired TTP, which stands for thrombotic thrombocytopenic purpura. But Ablynx also strengthened our R&D with its innovative nanobody technology platform, which has applications not only in hematology, but also in respiratory and immunoinflammatory diseases. So these steps dramatically reshape our portfolio in specialty care, giving us a leading position in hemophilia and other rare blood disorders, and significantly strengthen our R&D.
But the market seems to think that these acquisitions were expensive.
Actually, thanks for your question, but it is important to note that we have maintained our financial discipline in doing these deals. In particular, we expect both to deliver returns above our cost of capital within 3 years, and we expect Bioverativ to be immediately accretive to earnings. So overall, after a period of significant reshaping since 2015, we are now positioned to drive growth.
What are you looking forward to in 2018? What do you see lying ahead?
2018 is a year we begin to make our success sustainable. We have worked hard to create value by executing on our strategic transformation. Sanofi is more competitive because we are better structured and focused on fewer lines of business. We have a more disciplined resource allocation. We delivered on all of our financial objectives, successfully launched a new immunology franchise led by Dupixent, and we advanced our pipeline and our research capabilities. Now in 2018, with our recently announced acquisitions, we will have a strong position in rare blood disorders, which we expect to create long-term value for our shareholders. And we anticipate Sanofi will be back to growth with expected business EPS between 2 and 5% at constant exchange rate.
Sanofi CEO Olivier Brandicourt, thank you very much.
Thank you.